Hi, my name is Tiffany House, and I'm the chair of the International Pompe Association. And with me today, I have Dr. Priya Kishnani of Duke University Medical Center in the United States. Dr. Kishnani, would you like to introduce yourself?
Um, Hello, Tiffany. This is Priya Kishnani. I'm a clinical and biochemical geneticist at Duke University. I've been here for the past 30 years and have been in the field of researching Pompe disease and caring for patients with Pompe disease across the disease spectrum throughout these 30 years.
Yeah, I
Thank you
think,
for the opportunity.
of course. And I think you and I have known each other for like 26 of those 30 years. So it's great to have you, and your dedication to the community is one that I know everybody appreciates. You're always available to patients and do everything you can to help, and that's very appreciated. Um, Today, the theme, or this year, the theme of International Pompe Day is the strength and resilience of the community. And I know that's something that you and I have talked about quite a bit over the years. So what are your thoughts on the strength and resilience of Pompe community?
Oh my God, Tiffany, you're absolutely correct. We have talked about this many a time, and I work with many of our families with Pompe disease. And every time I speak to an individual with Pompe or a family member, I'm always struck by exactly what you said, the strength and the resilience.
Mhm.
I also put it this way, they are extremely patient. Um, whether it is participation in a clinical trial or willingness to share data and information, hearing that someone else is doing well, even if it's not themselves. There just seems to be a community spirit in how everything is approached within this community. And it's really humbling when I've seen many of the adults with Pompe disease, right when we were first developing enzyme therapy,
Mhm.
Tiffany, you were one of them, the patient wait for your turn, so to say, making sure that the babies
Yeah.
first got a life-saving therapy. And then as we go to the next wave, and now we talk about gene therapy.
Mhm.
Again, now the community is stepping up and saying, let's protect the babies or the children, and we are ready to first make ourselves available. Or, when we ask for record requests or data from different sources, I'm just completely amazed by how much this community has given. And in fact, I feel privileged to be a part of this. And when there's a loss of a patient's life, I have seen the community come together
Mhm.
for the family, reaching out to us as treating physicians, trying to find a way to make things better.
Mhm.
On occasion, even families reaching out, willing to make donations. I mean,
Yeah.
when I'm talking about donations, Tiffany, I'm not talking about financial. It's the individual themselves.
Yeah.
This past year, I lost an adult, and I think one of his biggest wants
Mhm.
was for the whole community of Pompe to benefit from lessons learned from him.
Yeah.
And he actually donated his body to Duke. I mean, this is humbling.
Yeah.
So this is an unusual community in terms of strength and resilience.
No, I have to completely agree. I think, we really are a strong community because we work together so closely. But it's not just the patient community. We're very fortunate to have doctors and researchers and scientists like you that work with us and collaborate with us. And we have that open relationship, which I believe is unique to our community, where it is, a family in a lot of ways, and friendships and community. And like you said, we're there for each other in good times and in bad. And yeah, I agree with you. That is definitely one of the major strengths of our community.
Completely, Tiffany. And just give me one moment, Tiffany.
Mhm.
Tiffany, it really is a very special relationship that, watching many of these children grow to adults and going to graduation parties or birthday parties or engagements, just celebration of life. It's just been unusual for me. And when I am looking at that next generation of clinicians and clinician scientists,
Mhm.
I think when they see our Pompe families, it has been very motivating for them to
Yep.
want to step in and actually continue the work.
That-
So
That's great. I think that that's something that we can all take to heart then and make sure that we continue providing that interaction and working with each other, because we do need the next generation and we need to keep going because we've come a very long way together, but we've got a long way left to go, and we'll do it.
we will do it, and we'll do it together. And I mean, Tiffany, from when we started, starting with muscle biopsy and skin biopsies to make a diagnosis, to now a dried blood spot assay, to having Pompe as part of newborn screening, to discussing, the first conversation with FDA and EMA about a therapy. But now we're talking about a host of enzyme treatment possibilities, including gene therapy and now even small molecule therapy.
Yeah.
It's unbelievable.
It really is, especially for a rare condition like ours. We're truly blessed and lucky to have the community we do. And I want to thank you so much for giving your time today and talking with me. And I think with that, let's say Happy International Pompe Day.
Happy International Pompe Day, and cheers to many, many more.
Absolutely. Thank you, Dr. Kishnani.